In today's video, Aditi Parashar would be interviewing Dr. Disha Shetye about mental health for BDS students. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed.
Good evening, how are you?
I'm good. I'm glad to talk with you, Aditi.
So, I would just like to introduce Dr. Disha. She's not just only a dentist, she's a counselor as well as a therapist. Okay, so without any further delays, we would quickly jump to the session.
Yes.
So, the first question to you is how we as dentist students deal with a sudden drop of confidence that we get by not getting into an MBBS college or a medical college.
Um, Okay, so I vividly remember the very first day of my college when one professor came and asked us, "Ki, how many of you are here because you did not get an MBBS seat?" I think this is
And
the one
everybody must have raised their
90%
hand.
90% people raised their hand, and I was not one of that. But then 90% was like, कि, हाँ हमको MBBS ही चाहिए था और हमको नहीं मिला. That's why we are here. But I don't think exactly confidence would be an issue there. I would feel students might feel a kind of despair or a frustration that I did not get MBBS and then I have to come here, which is not my first choice. So there would be a lot of frustration, a despair, a kind of a helplessness maybe कि मुझे यहाँ पे लेना पड़ा admission. I had to take it. It was not my decision. And I think here lies the key. When we say कि मुझे लेना पड़ा admission or I had to take it, there was no option. When we use this kind of vocabulary, it is like कि we did not have an option, इसलिए हमें BDS लेना पड़ा. But actually, if we see that we took it by our own choice, nobody thrashed us into this कि नहीं तुमको BDS ही लेना पड़ेगा नहीं तो life में कुछ है ही नहीं. It's actually if we say कि लेना पड़ा नहीं, I took the choice or I took the decision of getting into the BDS. Now whatever could be the reason कि MBBS में नहीं number लगा, जो भी कुछ है,
I think it's
but that.
lack of awareness actually. We were so prepared for MBBS and we saw it like online also, and all the web series also are based on medical students' life and everything. So there was less of dental content even online. That's why I think there was lack of awareness. It was not a sudden drop of confidence, it was sudden drop of hope basically that
हाँ
we
हो
expected
मतलब
this and we got
हाँ
it.
that we had that idea and I know कि it must be disheartening definitely कि आप एक कुछ
Right.
गोल रखते हो आंखों के सामने and you don't get it, and I agree with it that it must be disheartening to see not getting your goal. But that is the point I want to make, that even if it that you did not get what you want, you still made a choice that you did not want to go for
Right.
another year maybe, and that's why you chose
Yeah.
to get into
And
here.
that is a wiser choice rather than because the
Wiser
rules
or
and
not wiser, you
regulations.
will come to know that later.
Yeah,
But and I say there are no right and wrong choices, but you
right.
made the choice. The moment you change the vocabulary के ऐसा नहीं है कि मुझे लेना पड़ा एडमिशन और मुझे ये कुछ ऑप्शन नहीं था इसलिए करना पड़ रहा है. That puts you into the helpless kind of situation कि मेरे में हाथ में कुछ नहीं. So you change the vocabulary, then you feel more in control that I took the choice of getting into it.
So how do students deal with the anxiety that comes with the quota, patience, and studies and managing so many things all together in between adulting?
If you like that video, please do not forget to hit the like button below. And I'm sure you're subscribed to our channel because we come up with amazing content for dentists out here.
I know you are the fourth year you mentioned na. I know the fourth year can be really, really tough because the पहले 3 years are quite smoother, but the fourth year is really
Very
hard
smooth.
pressing for you. So see, the practical difficulties are there. I'm not denying that there are a lot of stressors. You have to do quotas, patience hai, exam dene hai. Then there is this pressure from the parents. Then there are our own friends. Hostel life के अलग problem होते हैं. So there are a lot of things, a lot of stressors in your life. Now the problem is कि you are asking कि how to maintain the mental health, right, in such
Right.
stressful situations, right? तो बेसिकली एक तो ये एक्नॉलेज करना है कि ये सारे स्ट्रेसर्स है मेरी लाइफ में. समटाइम्स वी जस्ट डिनाई इट कि इतने सारे स्ट्रेसर्स आ भी सकते हैं. एंड ग्लैड यू आस्क्ड नो अबाउट द मेंटल हेल्थ फॉर बिकॉज दिस इज द टॉपिक. क्योंकि जनरली परसेप्शन ऐसा होता है रिलेटिव्स का या ओवरऑल थोड़े ओल्डर जनरेशन का कि इनके पास सब कुछ तो है, we have given them everything, they are in their
Exactly. They have
luxury, then what is
everything.
so problem, इतना क्या mentally pressure है. And I get to hear this a lot. But then I educate them when I go to talk to a dental collegist. I tell them that the time have changed. You know, I always talk with my friends and batchmates कि we are so lucky कि हमारे time पे social media नहीं था, and we got through the graduation smoothly. Now, unfortunately, fortunately, whatever, you guys are there, you know, with this social media world, and it adds on actually to your
Totally.
current views. कितना भी करो, it does distracts you a lot. You know, इसमें basically क्या होता है ना कि it is the pleasure is at your hand so much that you just can't. ऐसा हो नहीं सकता कि आप बोलो कि मैं यूज ही नहीं करूंगी, मैं बाजू में ही रख दूंगी. One ping and you tend to look at it. You know, it is that distracting. So social media
Totally.
does have a lot of a stake
Negative
at this.
impact.
या तो एक्चुअली एकदम बेसिक चीज पता है, सुन के ऐसा लगेगा कि ये तो बहुत बेसिक है. Sleep, exercise and a good diet. I mean, it sounds very basic, but a good 8 hours of sleep, which we compromise on in our fourth year in doing all this, because a good sleep gives you a good focus. APA, American Psychology Association, has proven that, you know, 8 hours sleep is very necessary to maintain that focus and to maintain the mental health. And exercise is called as literally the cheapest antidepressant, cheapest and the most underestimated antidepressant. So if you feel like very low, frustrated, irritated
You
with
should
all the amount
exercise.
of,
Run.
yeah, anything you can do, dance, anything that sweats you out. Reasonably good diet. I know कि college के time पे इतना good diet नहीं follow हो पाता. We eat a lot of junk, which is okay. But reasonably good diet. These three are the very fundamental basic pillars of actual mental health. So physical health and mental health is very much related. So you know that when you feel bad in your body, your mental status is also ruined. So even these three basic things now, sleep, exercise, and diet, if you try to keep a balance of it, you would definitely see a lot of more resiliency in your mind. And the one tip I would like to give is that we try to make schedules. We make a lot of time schedules. कि ये ऐसा हमको, you know,
Timetable.
timetables. We make huge timetables. And I know that 99% of the times we
No,
like to
don't
fail.
follow it.
And no one follows, we fail. You know, I counsel many students और उनका सबका majorly one factor है why this goes derail is the procrastination. हम सब बना लेते हैं schedules. हमको पता है कि हमको patience करने हैं, हमको ये एग्जाम की प्रिपरेशन
Quota
करनी
finish
है.
करना है.
We know it that this is important, quota,
Right.
but we procrastinate. Procrastination में basically क्या होता है, we replace something very necessary with the secondary activities. So your secondary
I think
activities,
students are like they are very mentally strong. They postpone it to the end. कि लास्ट में पढ़ लेंगे, लास्ट में कर लेंगे, 15 दिन में कर लेंगे. That way. So
हाँ, and I'm
students
not
do
saying
this
कि
and
नहीं
that.
होता, you know, I'm not saying कि नहीं होता. मैंने खुद भी किया है 15 दिन में.
We
ऐसा
all
नहीं है कि
have.
नहीं, ऐसा नहीं है कि नहीं होता, but at what cost? At what cost? That is the question, you know, with so much of
Right.
anxiety, so much of stress, at what cost, basically? Or maybe, you know, I do this exercise with students live जब मैं करती हूँ. I can't do it right now, maybe I can just tell. So I ask them to draw cat face, okay? A cat face in 3 seconds. And they draw it very fast. 3 seconds में cat का जैसा face बनेगा वैसे बनेगा. Then I ask them again to draw a cat face. Now I give them a good 10 seconds. So 10 seconds में वो cat का face, and then I ask them to see. So obviously a 10-second वाला cat
Of
looks like
course.
a
The
cat,
better.
and a
Yeah.
3-second वाला cat looks like a circle probably just. So
Right.
this is the difference. When we say कि 3 second में भी काम होता है, तो last के 15 दिन में भी काम होता है. But when we get that extra 10 seconds, you know, extra time, तब आप detailing add करते हो. Your works become more better. You know,
You
it's
give it
not
a
just
touch
done and
of your
dusted
own.
with it.
Yeah.
Yeah,
Hmm.
maybe you can add more to it. So procrastination पे अगर आप हम काम कर सकते हैं, so that would definitely, you know, bring down that overwhelm and burden के इतना सारी चीजें करनी है. And I'm agreeing that there are a lot of stuff. बहुत सारी चीजें होती है. Fourth year is demanding, and that's why does require a more mental strength, which would come from the basic three things I mentioned to you. And this habit, if you can work upon on not doing the procrastination, just making a timetable will not help if it is to be procrastinated, right? So I think
So,
this
do you think
one
the
way.
younger generation is lazy? Like the newer generation is lazy and procrastinating more than the people who were studying dentistry
No,
before?
no, I don't agree with it that newer generation is lazy. I would just say that they are more distracted. Again, with the
Okay.
same reason that it's now it's everywhere. See, I saw the Orkut or a Facebook when I was in internship. We had a lesser
Hmm.
distractions. Okay.
Right.
Now, and social media is pleasurable, no doubt about it. Okay, one interesting
Totally.
thing, a tip I can give is ke, what if, do you like to have chai? Do you enjoy chai? Do you like tea? So
Love tea.
what if I give you a gulab jamun to eat, and then I ask you to have a chai? How would that chai taste like? Peaky, right? This is what we
Hmm.
do. We first scroll through Instagram, we enjoy it, और जब बाद में पढ़ाई करने बैठते हैं तो ऑलरेडी बोरिंग पढ़ाई
When we are
और बोरिंग
tired.
लगने लगती है. It's like फीकी.
Right.
So we do this way कि पहले मैं थोड़ा सा सोशल मीडिया पे या कुछ भी एक नेटफ्लिक्स पे एक फ्रेंड्स का एक एपिसोड देख लेती हूँ, फिर मैं पढ़ाई करने के लिए
Then
बैठूंगी.
we'll continue.
Now this is like
Right.
having चाय after a गुलाब जामुन. And this is where the फिर मन नहीं करता, फिर हमें लगता है कि मेरा फोकस नहीं हो पा रहा. Now the students
Hmm.
come to me with this problem कि I have a less focus, I have a problem with concentration, मैं ज्यादा दिन एक टाइम पे पढ़ाई ही नहीं कर पाती. Now this is what because of the distractions around. So उल्टा करना चाहिए, पहले चाय पी लो and then enjoy your gulab jamun basically. And in
Right.
your scheduling, schedule a time for pleasure also. It's not just कि schedule only study time. Pleasure time भी हम schedule कर सकते हैं.
So back in school when we used to give exams, so every time, even a good paper or a bad paper, we ended up passing the exam. But here in dental college, it's not like that. When we give exam, we either fail or we pass or we like have distinction. So how can like students who fail like overcome this guilt of, like I was such a bright student back then and what happened to me right now? Failure in exams and anxiety in exams. How do we deal with that?
uh, Actually, ये जो word है कि I fail in the exam, and normally how we friend and everybody reacts to it that कि we sympathize with who has failed the exam, that it's okay, let it go, you will do it better next time, इतना ध्यान मत दे, चलता है, तू next time कर लेगा, it's not a big deal, right? This is how we try to
This is
be
how
with
we,
that person.
console our friends.
Yeah, we try to be for them as much as possible, the person who has failed, as you are saying. The problem is कि we don't acknowledge के fail होना definitely बुरा लगता है, right? So nobody likes to be fail, and for that person it's definitely a very very bad thing to happen. मतलब उसको शायद वो expected भी नहीं था, या expected भी था तो बहुत जोर से झटका लगता है कि how can I. So, first of all, I would like to acknowledge here that it's very natural for that person, you to feel very bad about it. So, it just can't happen. Ke, be okay. That would be a very wrong
Yeah.
statement to say to that person. And so, people tend to be very depressed about it. कि I failed. एक चीज होती है कि हम अपने आप को लेबल कर लेते हैं. लेबल मतलब क्या कि I failed, that's why I'm a failure. So you unconsciously put that label to yourself that I'm a failure, I failed this in exam. So, as you're a dental student, I can ask you this question. Like, suppose if you have a very grossly carious tooth, okay, would you, what would you say? That I have a grossly carious tooth, or I am a grossly carried person, or something is grossly carried with me? Would you say that, or would you
The
say that
tooth,
I have a
grossly
grossly
fail.
curious too?
Yeah.
As simple as that, you say I have a car. You don't say I am car. But when something comes to our own, like this, a failing an exam, we immediately put up a label. कि I have failed, I am a failure. I am failure जब आप label करते हो तो you feel very down. You self down
Yeah.
yourself, you beat yourself, you feel a lot of guilt. कि मैंने अपने पेरेंट्स को ये नहीं किया, didn't live up to their standard. You probably some probably feel shame कि लोग क्या सोचेंगे, shame in that context. Some probably feel very depressed about it. You have faith, so let's acknowledge that कि ऐसा हुआ है. उसको हम बोल नहीं रहे हैं कि कुछ नहीं हुआ करके. I am not saying कि कुछ नहीं हुआ है. Definitely,
Don't you
it's
think
something.
teachers also do that to students? Like once you get a KT, you are labeled as this backbencher, or you are
Yeah.
asked
That
continuously
is
that
our
how much did you
conditioning.
score in the
तो
KT?
लेबल इसलिए होता
Yeah,
है कि हम बचपन से बहुत कि यू आर अ गुड बॉय, यू आर अ गुड गर्ल, इफ यू डू दिस यू आर अ बैड बॉय, यू आर अ बैड गर्ल. तो वो
right.
लेबलिंग हमारे खून में है, हमारी जीन्स में आ गया है. तो we are not wrong in jumping to it, but ऐसा होता है. And this is where I want to educate कि take a pause and see if you are labeling yourself. तो ये आप जब लेबल हटाओगे, you would see a lot of improvement in your own feelings. एंड जब awfulness की बात आती है, it's an awful thing or it's horrible thing
Hmm.
that happened with me. A simple thing one can do is that evidence. What is an evidence? That is, it is the most awful thing. You can actually talk to the people who have gone through this in the past. और उनका प्रोफाइल देखो कि was that the most awful thing in your life? तो वो बोलेंगे नहीं, उस समय लगा था कि सबसे बुरी चीज है, फिर उसके बाद लाइफ ने
हाँ,
बहुत कुछ दिखा दिया. फिर and they must be at a very good position, running a very good clinic and doing MDS maybe. I have friends who failed in their BDS, but now they are doing like their MDS and doing very well. So वो awful लगेगा, उस time पे लगेगा. But when you change it to the by asking evidence, really it's an awful, then you think that अच्छा नहीं, it is bad, it is pretty bad, but not awful. Talking to the
right.
people who have gone through it, then you will realize कि नहीं, इतना भी बुरा नहीं है जितना मैं सोच रहा हूँ.
Oh, so my next question to you would be, how was your like experience when you did your first patient? What were you feeling? What wh-
अच्छा,
what
tell
happened to
you
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 then?
tell me first, were you anxious when you did your first patient?
When I did my first patient, it was a composite restoration. So we
Hmm.
were taught amalgam. I read about everything. I only knew about the properties of composite. I didn't read. And sir was like, you have a patient, you should do it. And I didn't wanted to say no. I was like, I will do it no matter what. Abhi aata bhi nahi hai, then also I will do it. And I ended
Okay.
up doing a great job.
Yes.
So
Now this is where
sometimes it's good.
ये जो है ना कि इसको हम एक तरीके से यूज कर सकते हैं टेक्निक को. इफ स्टूडेंट्स वांट टू यूज इट, दिस इज कॉल्ड एज ए प्रेडिक्शन टेक्निक. प्रेडिक्शन टेक्निक में क्या होता है? सो इफ यू आर फीलिंग एंग्शियस और मुझसे नहीं होगा, then you predict it that how difficult it would be. Okay, so prediction scale would be like 0 to 100, and suppose you rate it like it would be difficult, say 80, and then you do the job, and you now you see ke how difficult it actually was, and probably it would come down to probably 30 40. Then you only disconfirm कि अच्छा मैं ऐसा सोच रही थी और ये ऐसा हुआ. Then this is a kind of an evidence
I
you
do the
use for
same
yourself.
thing. I
Yeah.
think what would be the worst outcome if
Hmm.
I do this, like some, if even if I expose pulp, what will be the worst thing? Teachers will fail me, they will scold me. But then I'm like, if what if it turns out to be something else? And then I go and do the job,
Yeah.
and it
ये
turns
जो
out to
what
be
if
great.
word है ना, what if, तो I asked you कि how were you feeling, because सबके बैच में ऐसे लोग होते हैं जो काफी कॉन्फिडेंट होते हैं कि हम कर लेंगे, और फिर ऐसे होते हैं जो बहुत एंग्शियस होते हैं कि what if. तो एंग्शियस लोगों में ये कंटिन्यू चलता रहता है, what if I mess up. But some people even after reading can have that jitters that oh my god, this is not dummy, this is a live patient, and if I screw up something, what if that patient scolds me, what if my
No,
teacher
it
scold me.
actually is there. That feeling is there that you're not doing
हाँ.
injustice to your patient by not knowing a
हाँ,
certain thing.
what if I do something wrong, it's a live patient, ये तो पहले
Right.
की बात अलग है. So all this anxiety is understandable and pretty much normal. First of all, I would like to normalize it. तो सबके साथ होता है. Just because if you see somebody confident like you, some people have seen you confident और उनको और भी डर लग रहा है तो और वर्सन हो जाता है. Why she's so confident and I'm not confident, right? तो ऐसा
Right.
मेरे साथ होता था. तो ट्रस्ट मी गाइस, अगर ऐसा है कि अदर पीपल आर सीइंग कॉन्फिडेंट एंड यू आर नॉट, डोंट जस्ट गो बाय द फीलिंग्स. एंड इट्स प्रीटी नॉर्मल एंड अंडरस्टैंडेबल कि फर्स्ट टाइम ऐसा लग सकता है, सबको लगता है. एंड यू कैन यूज सम काइंड ऑफ कोपिंग स्टेटमेंट फॉर योरसेल्फ. So it would be very customized for each different people. So for an example, some coping statements I can give is like I am in a say a supervised environment where I am allowed or permissible to make mistakes, which will be supervised. And then फिर आप वो इतना mistakes के बारे में नहीं सोचोगे कि what if. So I'm in a basic fact that I'm in a supervised environment, and even if I make mistake, that means that I am learning, and it's a skill.
Right.
The third statement, it's a skill which can be learned. It's basically a skill which can be learned. Correct? So some coping statements you have to keep ready with you. Not positive statements. Positive statement नहीं कि अच्छा ही जाएगा, मेरे को सब आता है.
Hmm.
This may actually
Hmm.
backfire. अगर कुछ गलती हो गई तो फिर आप बोलेंगे मैंने तो सोचा ही था कि कुछ अच्छा नहीं होगा. So
कुछ
let's
अच्छा
give a
नहीं है.
realistic coping statement that even if I make some mistakes, I am in a supervised environment which can be rectified. That means that I am a student which can make mistakes. And it's a skill I
Yeah.
can learn over a period of time. These are the realistic coping statement one can use.
So I'm asking you, as a final year student, as we are, towards the end of the race, we are in
Okay.
between parents asking us what to do next. We are in between colleagues asking us, MDS दे रही है कि नहीं? What are you planning to do? So how do we deal with anxiety that comes with people asking us that now you'll become doctors, now you'll
Hmm.
be called as a doctor, like how like life changes as a student and then after becoming a doctor, and what to do, like how do people know that what they want to do after BDS?
So, as I understand your question, that you're asking how to know what to do after BDS, or basically how to handle the pressure of,
How to handle the pressure and then how to know also, because there are some people who are skilled in something and they want to do something else, like I really want to do something else but I am good at something else, that way.
hmm. So, is it about a career change you're asking me, or is it just a
Yes.
general comparison of the field कि आप BDS में है और आपके इंजीनियरिंग के फ्रेंड्स
Anything,
बहुत ज्यादा.
anything.
Okay,
So
so
that
the
is
final
also there.
that is
Yeah.
very much there because final year and internship ऐसा period होता है जहाँ पे you lose out on your patience. एक तो 5 years लग जाते हैं BDS complete करते करते, and the other people who are non-medicos probably done in 3 years or 4 years,
I was
and then
about to
you
add that also. Like your own
okay.
colleagues are asking you this question, and then there are people who are graduating, doing jobs, getting placed in Microsoft and Google, and you watch them updating status on Facebook that started
And they're
working at
getting
Google,
paid and they're spending money
taking
going on a vacation
taking their parents out for a fancy dinner date.
and tagging and telling that this is my first pay, this is my first this thing, my first that thing, and it feels
Right,
very bad to make up why I am into this medical field, right? So we all
right,
go through this phase specifically in the internship period. I would say जब आपको fifth year में होते हैं and everybody is the non-medical field, engineering ले लो या कुछ और ले लो जहाँ पे people are settling faster. See, actually में देखा जाए that's the reality कि ऐसा होता है. So there is this one example I really like, which I can tell you here that suppose like maybe you are having few friends who are not medicals, right? And
right.
now you will go in an internship and probably they would get a job first, and you would feel कि हमने साथ में start किया था और ये जल्दी जल्दी settle हो रहा है, मेरे को इतना time लग रहा है, right? It's possible that because we used to feel that in our BDS days. So basically, this is an analogy which I use that suppose that there are two seeds, okay, seeds like a beach, and the two seeds are friends, and they grew up, they were together, whole their childhood and everything. Now it was time to plant them, and one was planted in a good one pot with a good environment and everything, and other was planted in a very different deserted kind of an environment, right? And
The growth
now
rate will be different.
because of the difference in an environment, this one seed in a pot had a better sunlight and everything, and good soil and
Hmm.
everything. He bloomed, that uh, seed bloomed faster and sooner and then better way. Okay. Now the other seed was in a different environment, started getting envious के यार इसको जल्दी इतना जल्दी ये he is bloomed and everything. I should also be able to be in that position. हमने साथ में ही start किया था. This is so wrong. This is unfair. Why
Unfair.
am unfair? This is unfair. This is the commonest theme we feel. And this is so unfair कि मुझे इतना क्यों time लग रहा है कि तो settle हो गया. Yeah, that seed might feel that way. And that seed then fails to recognize that he was not the only one who was in that environment first. Okay. If he goes and sees around, he would see plenty of bloomed plants in that environment with flowers, with fruits, probably dollars on that trees. Like the dentists who mint the dollars also. So like that, if we see कि अच्छा ऐसा नहीं है because I took a time, that doesn't mean कि I would be like this forever. Just because it is taking time, it is the problem of an environment for that seed. Let's
Right.
take an example because it's a different thing and comparison would happen. So, I will not say कि कैसे comparison नहीं करे. उल्टा मैं बोलूंगी कि comparison तो होगा ही. We are humans. We would make comparison. Comparison is tend to happen. But let's see the reality part of it. The environment is different. Like for that seed, it was totally different context. So he would, like I always say, na, कि evidence क्या है? So if we see around him, if we see about other dentists, like other seeds, they're blooming. It took time to them to bloom, but now they bear fruits and flowers and dollars on their trees. Then that would make sense.
So, what is that one thought that comes to someone's head when they finally decide to do something, like with respect to career shift or even an MDS? What is
Hmm.
that thing which comes to your mind, and then you are like, yes, I want to do this only in the future?
I
What
would
makes you
say
so
that.
confident about yourself that yes, you'll be able to do this, even if you are planning to do something new?
See, confidence is very subjective. I mean, I personally don't like this, word of self-confidence because self-confidence कभी-कभी गलत चीजों पे भी rely हो सकता है. For an example,
Right,
you know that some people are very confident but may not be that good in their own work. Possible, right? Some people are very
right.
good in their work but may not be very confident about it, even if being good in their work. So rather than using this word of self-confidence, I use the word task confidence. Task confidence is something
Hmm.
that with the practice, how much you are competent enough in that task. Okay, so that gives you task confidence. So always talk in terms of task confidence. So for some people, clinical work is they are good at it, and that's a task confidence they can talk about. And this decision of doing what, doing clinical work, doing MDS, or doing something else, is
Anything.
totally personal choice. But I would say don't change your career for wrong reasons. Wrong reasons would be के यहाँ पे पैसा नहीं है, अदर प्रोफेशन में पैसा है, यहाँ पे मेहनत लगती है, बहुत तामझाम लगता है, अदर करियर बहुत इजीली सेटल हो जाऊंगी. दिस वुड बी रॉन्ग रीजंस टू गो फॉर
What made you
switching.
decide that you want to switch to a completely new and
Yeah,
different
so
field?
this is the
It's like
very
going
common
towards a
question.
one direction and then you deciding to go back and to go some other
Yes.
direction.
It was a very difficult decision. Didn't come overnight. I did talked about it in another video with Satish sir, and I said that it took me long years to come to this decision of switching to another career. But I always knew that I did not enjoy clinical work much. I knew that for sure. Okay, I would go into probably teaching maybe, do MDS and get into the non-clinical branch maybe. That was always my option. कि मैं कुछ और. So I tried to give MBA and everything, all that sort of stuff. So I knew my why. That's what I was coming to. Know your why. Why would you want to switch it? And don't do it for wrong reasons. As I mentioned, do it for right reasons, even if you want to change it. And
It
it's
takes a
not
lot of
about.
courage actually to,
It
switch
does.
to a
It does.
completely.
It does. It does take a lot of courage. But वो एक होता है ना कि मैं कहती हूँ कि राइट और रॉन्ग डिसीजन कुछ भी नहीं होता. It's about well informed decision.
No,
आप
like
डिसीजन
people
लेना.
think that they have already invested so much time into something, so it's about 2 3 years more. So they think that way,
I
and then they
my
are like
thought
too
personally
scared.
was कि I have invested so many years. Yes, but the rest of my life is much bigger span of time, and that I want to live in a different way, not this way. So compared to the 5 years, that rest of my life seems much larger to me, longer to me
Right.
to live through. So for me, that was my own counter के 5
I
साल
think
ठीक है.
everyone should have this mindset and think this way only rather than thinking कि I have already spent 5 years, so what if 2 3 years more, and then I'll do some job that way.
हाँ, नहीं उसमें भी कुछ गलत नहीं है, ऐसा नहीं है कि आई ओवरनाइट जंप टू दिस कंक्लूजन कि मुझे साइकोलॉजी में आना है. इट टुक मी टाइम, राइट? आई यूज्ड टू बी प्रैक्टिसिंग इन हॉस्पिटल. I practiced as a staff in Penna Dental College. So I did here and there a lot. So it was not like
You
suddenly.
explored your options.
I
Yeah.
did explore my options and yeah, so just let it go. मतलब वो टाइम बहुत प्रेसिंग रहता है, वो फोर्थ ईयर एंड इंटर्नशिप वाला. सो मेक एन वेल इन्फॉर्म्ड डिसीजन. डोंट वरी कि वो राइट है रॉन्ग है, वो तो टाइम के बाद पता चलेगा. यू वोंट बिलीव सो मेनी स्टूडेंट्स, बीडीएस स्टूडेंट्स approach me after seeing the another video with Satish sir about the
Hmm.
psychology field.
I texted you.
You did? Okay. So,
Yeah.
yeah,
You
Aditi,
sent
yes.
me a voice note also
Voice
telling
note.
ki you can do
Yes.
this and you can do
So
that.
I do send voice notes to all the inquiries. So basically, they ask me how to switch and everything. So first of all, I always make a point to tell them that why you are switching it. Because just because another people are doing it, just don't do it for the sake of doing it.
But students are doing a lot many things. Like one of my friends, she uh, she didn't even shift. She started her own wedding planning company, and she is doing great right now. Just as soon as she was done with her internship, she started during her internship only, and now she's going to countries to get people married. And she's saying that I never thought my life will be like this after doing dentistry. And she's
Then
very
you also
happy.
compare with that person. अरे वो तो countries घूम रही है, मैं तो इधर ही हूँ. So
No,
in
you
that
it's
way
like you
also.
never know where you will end up end of the
Huh.
day. Like
So
I am
even
taking
I
myself
know,
as a doctor, but
yeah,
I don't know.
I know people. I know many BDS graduates who are now a full-time baker, doing wonderful in baking
Right.
industry, fashion models, and even air hostess. I know one of many different career people choose to be like many. So ऐसा कुछ नहीं है कि hard and fast कुछ नहीं है. And even dentistry itself is a very nice career. ऐसा नहीं कि you have to change it to
Totally.
something else.
Yeah.
Like how engineers do it. Like nine, they say it like कि engineers में से आधे से ज्यादा लोग तो MBA करते हैं and then change their field.
Hmm.
So ऐसा नहीं है कि dentist is not a good field. It's a good field. Now this is the platform of a Kaizen. वहाँ जहाँ पे आपको इतनी information है. We did not had this information at my time. If I had this much of information from Kaizen, I would have probably on a totally different prospect, maybe. कुछ और ही होता था.
Right.
Now that
What
there is
you
a
are.
lot of exposure available to you guys, like to you student, अभी स्कोप के बारे में इतना कंफ्यूजन नहीं है. कि क्या क्या हो सकता है. At our times it was like MDS, clinic, या hospital administration. It was only three
Yeah.
choices.
Three options.
There were only three choices that we used could be thinking of. But now the scenario has changed, so there should not be a problem about scopes.
So what is your advice to a final year student who's
That
exploring
I
their
already
options?
get. Yeah, I already said that, it is overwhelming, accept it firsthand, and not last minute. Last minute would be a very overwhelming, stress giving, and anxiety giving. One analogy or one example I would give, which is my favorite. तो बिकॉज ऑल्सो आई एम अ थेरेपिस्ट, तो मेरा देना बनता है ये एडवाइस के डेंटल में एंड मेंटल हेल्थ में देर इज वन सिमिलरिटी कि डेंटल हेल्थ में जब रूट कनल तक दांत जाता नहीं है तब तक पेशेंट आते ही नहीं है. सो इवन इफ इट दे नो इट इज कैरिड, तब तक वो आते ही नहीं जब तक रूट कैनल नहीं तो एक्सट्रैक्शन नहीं होता तब तक. सिमिलरली मेंटल हेल्थ में आपका जब ब्रेकडाउन नहीं होता तब तक लोग आते नहीं. इवन इफ दे नो
Totally.
साइंस कि मुझे एंजाइटी हो रही है, मुझे स्ट्रेस हो रहा है, मुझे कुछ प्रॉब्लम है, आई एम नॉट फीलिंग गुड, आई
But
एम
they
फीलिंग
don't
लो,
come.
दे विल नॉट कम अंटिल द ब्रेकडाउन हैपेंस और समथिंग इररिपेरेबल बहुत ही खराब है तब आते हैं. So this is the very huge similarity I see in dental and mental field. So by going by this example, for the students also, if it is becoming too overwhelming, and so break the stigma, go and ask the help. There are now, so you guys, your generation is very much open towards
Very
seeking
much
mental
open,
help.
and the parents are also
Very
very
much.
supportive.
My
Very
maximum
supportive.
90% clientele are students this age only because they don't have that stigma, na,
Right.
that they seek help. So that is the point I would make for fourth year students specifically now that you asked. Don't wait for the mental breakdown to happen or something. Even if you feel कि कुछ भी जरूरत है, even for the procrastination habit I mentioned, that can be worked very well with the therapy. So don't wait for the root canal or extraction to get happen. Go it when you
Go
first
before.
notice the distress. Yes.
Right. So thank you, and that was an amazing session with you.
Thanks, Aditi.
And
Yeah.
I didn't expect it will turn out to be this informative and full of examples and chai and gulab jamun, everything.
Yeah. That's my favorite too.
Thank you, Dr. Disha, for joining in. I
Yes.
hope you
Thanks,
enjoyed it.
Aditi. Yeah, I enjoyed it a lot. Thanks, Aditi, and wish you a very good luck in your
Thank
fourth
you
year.
so much.
If you like this video, do not forget to check our video on the mistakes young dentists make so that you can avoid those mistakes.